Shakir and Dr. Dua, thank you very much for joining us for World Federation Neurology News channel through YouTube. We heard the somewhat depressing but still interesting and entertaining news of the release of Neurology Atlas. What is it? Why should we care? Why is it important?
Thank you, Tissa, for giving this opportunity to describe the Neurology Atlas. It's very important that when we look at the numbers, we look at the numbers from both the angles. One angle is what is the burden due to neurological disorders. So we know that, for example, more than 8%, around approximately 9% of burden is due to neurological disorders. The other thing policymakers need to know, what's happening to address the burden, what resources are available, what policies needs to be doing, and that's what Atlas is about. Atlas is about collecting and synthesizing and disseminating information on country resources for neurological disorders.
Professor Shakir, you told us that neurological disorders now become the #1 cause of disability worldwide with Valerie Fagin's paper, which you co-authored, including multiple other authors on global burden of diseases that was published in Lancet Neurology recently. Tell us about the importance of this and the good work that you have done to bring stroke back to neurology, making this actually happen.
Well, I think you used the word neurology has become. It's always been
right.
The #1 cause of disability, if you like. They call it in medical terms DALYs, and the second commonest cause of death across the world. But the issue was, how do you count this? And now we are able, with the new classification that is coming from the WHO, that governments now will count neurology, will count stroke as part of brain diseases, and brain health becomes important. So these figures before were mixed up together with other illnesses so that brain health was not clearly defined. And this is, if you like, the most important achievement that WHO and WFN have collaborated in informing statisticians that this has to be settled. And it is now agreed, but the statistics that convinces governments that brain health deserves much more investment in manpower, in hospital facilities, and more importantly in primary care facilities is something which they need to invest in. And it's very important to say that there are two aspects. There is the prevention, treating hypertension, reducing salt, exercising, reducing diabetes, to reduce, for instance, a third of dementia can be prevented if we use all these preventive measures. And more importantly, there are now acute treatments. So now someone with a stroke, within 4.5 hours of having it, has a reasonable chance of reversing the deficit if he gets something simple called a CT scan. With a CT scan, and somebody who can look at a CT scan, even on a mobile phone, a decision to give what is thrombolysis, which is clot-busting drugs, can lead to improvement. And I always give an example. My mother, bless her, she's 94. Last year, she was admitted to hospital, weakness down the left side, face come down, and luckily there was a CT scanner, but there was no neurologist in that hospital. Neurologist was in another hospital. So this is how technology helps. The images were sent to that radiologist. He said, yes, it is a stroke that may respond to thrombolysis. We were asked as a family, we said yes, because she said, I would never like to be left disabled. The clot buster was given to her, and within 7 hours she regained her function. Now she walks, she goes to the toilet, she does all her activities. So that is an important part, is management. Because people in the governments in the past thought brain diseases were untreatable and they never touched them and they are unpreventable. The answer is very clearly that is incorrect. And this information has to come through to the public, because the public also does not know about the real way to prevent and to manage and treat diseases of the brain.
So in summary, neurological disorders are common. Neurological disorders cause disability. We have known this even before, but numbers needed to be corrected with this classification, for which you yourself and other leaders in the global organization did tremendous amount of work in conjunction with World Health Organization over the last 8 years. Thank you for that.
Thank you, but I have to say that without the WHO department which we belong to, what's called the technical advice, that's what they call them in the WHO, the technical department was crucial. And their help was, without their help, we couldn't have done it. We push the WHO, and Tarun is an employee of the WHO. We need to show them evidence. We have to come up with evidence. We have to come up with the science. But once they believe in that, they run with it. And it takes time. WHO is not an organization. It's like an oil tanker. It needs time to turn. But when it turns, it turns. And this is why I've done. I don't know if you want to add anything to that.
I think the point here is that just to clarify, that international classification of WHOs for diseases is a core responsibility of World Health Organization. The international classification of diseases, known as ICD, is taken up by the Ministries of Health and implemented by the Ministries of Health. Now, when classification is revised, and when we started the process of ICD-11, WHO appointed a set of technical advisors. Technical advisory group was established, and Dr. Raad Shakir plus other experts were member of that technical advisory group. And in their capacity of that advice was provided to WHO that stroke is a neurological disorder, and the reason being knowing very well that it is because of the neurovascular unit that we need to look at the impact on the brain, but also the cause that lies in the brain. It is important that it is reclassified in the category of neurological disorders. Stroke has already been classified for last so many years, but it was classified under cardiovascular diseases. So it has been the advice from the technical advisory group, including Dr. Raad Shakir, to WHO was to reclassify within the neurology chapter. The evidence was provided, the advantages and disadvantages, because changing a classification system is not so easy, were discussed, and a consensus was reached in discussion with the experts who were looking at the classification from a cardiovascular disease perspective, that stroke should be reclassified as a neurological disorder. So that's the change it has happened. It doesn't change the overall global burden of disease figures. What it changes is where is the stroke, for example, classification is happening. That's the change, and it is an important change for statisticians when ICD-11 will be implemented at country level.
Stroke, one of the greatest advantage of this conference that I have noticed is the neurology has gone leaps and bounds to the front, and it's therapeutic in all corners, stroke in particular. The stroke patients nowadays, as Professor Shakir mentioned, can walk in with complete paralysis and walk home alive, well, clot being removed, and prior to that treated with clot buster therapy. That said, when I was listening to your plenary on the Neurology Atlas data today, I noticed that almost half of the world is not having dedicated funding for neurological services. There are countries without neurologists. There are countries without being able to prescribe even simple thing like Parkinson's tablets. How are we going to address these disparities? I'll ask this question from both of you, the World Federation of Neurology as well as World Health Organization. Where can we start? I know that the coming to this sort of a conference and learning from one another and networking, that is a good start. Any other thoughts?
So there are quite a few things that needs to be done, and I can, one of the things that is important is raising awareness. Globally, raising awareness nationally, raising awareness locally. that neurological diseases are burdensome. There is a burden because of neurological disorders. So I think that's the most important point. And the global burden of disease figures help us to do that it is important. The second important thing that is for policymakers is important to understand is, can these disorders be prevented and treated? Are there any cost-effective treatments available? So we talked about stroke, looking at some of the other examples such as epilepsy. We have extremely cost-effective interventions that are available. So even then, the treatment gap is very high, more than 75% in many low and middle income countries. Now, that's the second message that is important. The third message that a policymakers asks is that, okay, how can we do it? And what are the different platforms, delivery channels that are important? And we need to think about an integrated approach, that there is an investment that is required for building the specialist workforce, the specialist infrastructure, but then there is also an investment that is required for integrating neurology into the primary health care. And it requires a systems-based approach so that this is sustainable. This is something that can be done and in a cost-effective and cost-efficient manner. And the fourth important thing that we need to do is to work in partnership, enhance the collaboration, cooperation across many organizations. So the collaboration that we have, for example, with World Federation of Neurology is synergistic. The efforts by WHO and WFN are complementary, and they can help us in achieving some of these goals that which are important. Because ultimately what we want is that people with neurological disorders, they are provided the care that is required. And many of these disorders that are preventable are prevented, so that we are able to decrease the burden, decrease the impact on community, on societies. Raad, you would like to add?
Thank you. Well, there are two issues Tarun has mentioned, and it's very important. At the end of the day, who provides the care? The people who provide the care are people who have the purse, the money, governments. Governments has to understand that brain health is very important, and brain health, investing in brain health will save lives, will save money as well, because their accountants has to agree that having somebody cured from a stroke will save thousands of hundred thousands, because that person will not need care, will not be disabled, will continue to be productive. Now, let stroke alone. The world is moving far, far ahead quickly in genetic diseases and preventing them, in therapies, in diseases which we never thought we could prevent, and some of this therapy is expensive. If you look at a disabling disease called multiple sclerosis, which many people know, treating that, I don't think I say treating, but modulating the course of that costs money. And in many countries this may not be possible or available. But making the people responsible for health understand that we really, the three words that I've used is underestimated, under-recognized, under-resourced.
That's right.
So the estimation and recognition comes from issues like the Atlas, comes from issues like we as specialists in the field making governments understand that this is a condition which they need to deal with because it saves them money to do so, and more importantly, it saves the lives of their citizens. And then resourcing it is the issue. And I fully understand that we in countries go and compete in a pot of money designated to health, and we compete with many other worthy conditions like child health, like vaccination, like women's health, like diseases of the heart, like rheumatological diseases, gastroenterological disease, and. So we have to show that investing in neurological management is important. The question that Tarun and the WHO thinks rightly is they want that available to the masses generally, and the best way is primary health care. We as specialists think, yes, that's possible, but some of our treatments, if not the most effective part of our treatment, can only be available in specialist centers, and that makes it difficult. But the whole world now have CT scanners. I don't think even in the low and low middle income country there is a CT scanner. The question is, can you use it? Can you put the message on a mobile phone? And if you did, who's going to read it on the other end and make the decision? That person cannot be in that location. So we have to come up with imaginative answers so that when we go and speak to governments about brain health, and I'm beginning more and more to use the term brain health rather than neurological diseases, because probably the public and those responsible for our budgets, governments, probably will appreciate to know brain health rather than neurological diseases, which is, in many members of the public may have difficulty in understanding what is neurological diseases. We have to explain it. But when you say brain health, everyone understands where the brain is and understand a healthy brain is good for you. When I used in my slide, I start by saying there's no health without brain health. And I use that in the building of the WHO when we had the meeting on dementia, and I took a picture with that banner with the Secretary of State for Health in the United Kingdom, and he said that is a good slogan. Ministers of health will understand what it really means. There's no health without brain health. This is what we have to promote.
I totally agree. Thank you very much for your time. Any final messages for our viewers?
I think my final message is we need to work hard for years to come to convince our policymakers that neurological diseases, brain health is important and as important as other areas of medicine in general, and investing in brain health is worthwhile for the public and for their budgets because it saves them money.
I totally agree. If I recall the numbers that quoted by Valerie Fagin and colleagues, nearly 2.8 billion people are suffering from neurological disability right now as we speak. So you cannot keep your eyes and ears shut when you deal with such a disability. So urgent attention is very badly needed right now.
Thank you.
Your final thoughts, Tarun?
I think to add on to what Raad said, the other point I would like to make is that we need to work together. We need to work not only hard, but we need to work in partnership. We need to work in partnership, the partnership between ministries, policymakers, academic experts, civil society, and people who are suffering, who are affected by neurological disabilities, as well as working in partnerships with private sector, media, everybody. Because when we work together, we are able to convey our messages much more than if we were working alone. So Atlas, for example, is an example of that partnership. And we hope that we can explore and build up new partnerships as we move in this next era of sustainable development goals and to tackle the burden that is there due to neurological diseases.
Thank you very much. Thank you very much for your time. Both the paper and the atlas that we talk about is freely available through World Wide Web. Anyone can download it. And the partnership and collaboration that you mentioned, this is the ideal place to build it. World Congress Neurology, and I have interviewed young medical students, I have interviewed senior professors, I have interviewed presidents of World Federation Neurology. They all talk to each other. Anybody can approach anybody. We hope in Dubai we would see 10,000 delegates coming and doing this. Let's hope so. Thank you very much for your time.
Thank you.
Enjoy the
Thank
rest
you.
of the
Bye-bye.
day.
Thank you.